We have two different ways to achieve universal coverage. We're hearing a lot from the Washington bureaucrats about limiting health care for everyone, making those sacrifices to get the economy booming and afford coverage for the uninsured. And we've been told by the experts who are advocating it that it will mean waiting in line for technology and maybe lower cancer survival rates as a result. And we know that because healthcare is the largest employer in the nation, it will also mean a slower recovery for gross national product and the loss of healthcare jobs. When you limit what hospitals will be paid and doctors will be paid, and you limit what the nation can spend on healthcare, some people in the healthcare area, nurses, doctors, therapists, environmental services people in hospitals, they're going to be out of work, right? Or there's an alternative, what we could call fix what's broken and leave the rest alone. We know we have the highest survival rates, or close to the top, for many forms of cancer, and we're second to none in the treatment of heart disease. So there is an alternative to reach out to those who need help. It's debit card technology. One proven way to do this is with debit card technology. In all 50 states, families who need help paying for another basic essential, food, receive an electronic debit card with purchasing power loaded on it every month from their state government. The states have literally eliminated fraud and abuse by going from food stamps to debit cards. The card holders of the food stamp program can go to any store and buy what they want. Similarly, we could load those debit cards with the power to buy health insurance. It would be very appropriate for several reasons. First of all, debit cards currently help about 23.2 million people, about the same number who currently need help buying health insurance. Let's put up that slide. Let's take a look at who really needs help. According to the Census Bureau, there are 47 million uninsured people. And of that, 37.3 million have household incomes less than $75,000 and therefore really need help buying insurance. But 14 million of these so-called uninsured are already eligible for Medicaid, S-CHIPs, and other government programs. They simply have to sign up. And that leaves 23.7 million people who need help affording insurance, almost exactly the same number that are already helped through the debit programs for food stamps in all 50 states. The states are practiced at doing this. Now, what are the advantages? Well, debit cards are probably better than refundable tax credits because many people only need help temporarily. They're out of jobs, they're between jobs, and not at tax time, right? Now, I won't go through all the numbers here, but I'm happy to sit and talk to you about them. Providing a comprehensive plan to every one of those 23 million or so people, providing it to their families, a comprehensive plan worth about $11,000 for a family, $4,400 for an individual, with sliding scale assistance, including total costs for any family below $50,000 in income, would cost somewhere between $30 and $48 billion a year. That's a lot less than the $600 billion blank check that the Obama administration is requesting for the next 10 years. With a higher deductible plan, it would cost even less. And this is simply a chart that shows how rapidly out-of-pocket payments as a percentage of total healthcare spending has decreased. If we provided families and individuals who were in that category, above Medicaid level, they're not poor, but needing some help in buying health insurance, if we provided them with a slightly higher deductible plan, it would free them from that constant restraint that insurance company bureaucrats impose on decisions like how often you can go to the doctor, which doctor you can see, which prescription drug you can get. So it would be a less expensive form of insurance, but also a liberating form of insurance. So we could talk about that, and that would reduce the bill of covering the uninsured even more. Here is the essence of this. Whatever way we choose, It's far less costly in dollar terms, as I said, than the $600+ billion that the Obama administration has requested. But more importantly for all of us in this room, it is far less costly and dangerous in human terms than a top-down system of government controls that will replace your doctor's decisions you make with your healthcare providers, replace them with decisions imposed by Washington bureaucrats. American healthcare has some shortcomings. The organization I founded works on one of those, preventing hospital infections. But we have so many strengths. The one I've emphasized here today that's so important to families facing cancer, heart disease, Parkinson's disease, MS, is that we have an excellent, almost unequaled record of curing the sick. Let's fix what's broken and leave the rest alone. Thank you.